Hi, this is Dr. Bhargava. In this short video, I have several interesting cases to share with you. We have a mucinous rectal cancer, we have stasis of PSMA in penile urethra, and we have PSMA for restaging prostate cancer. Let's get started. Here's our first patient. They presented with history of mucinous rectal cancer. Mucinous rectal cancer, as opposed to conventional rectal cancer, is an uncommon variant seen in up to 20% of cases, and the cells in this cancer produce a lot of mucin, which has a low density or fluid attenuation on CT. So here are some images from this patient's CT scan where we find that this is the rectum and it's filled with low density material. They have been diverted, so the tumor was causing obstruction at some point in time. And here is another image from their CT showing severe right-sided hydronephrosis and severe and even chronic left-sided hydronephrosis with more severe cortical thinning on the left side compared to the right side. And I will show you later why this is important in this patient. So let's take a look at this patient's MRI. So they have mucinous rectal cancer. Here on the sagittal T2 weighted image, we find the rectum is just markedly distended with mucin. Mucin has this high T1 signal. The tumor, because there is mucin inside the cells, is not very cellular, and so it does not show the same signal intensity of a solid tumor. So there is high signal because of the mucin, and we see the same thing here on the axial image and on the coronal image. Because the tumor secretes mucin, there is no internal enhancement. There is only peripheral enhancement and some enhancement of the septa that extend from the periphery into the tumor. Similarly, because there is a lot of mucin, there is no restricted diffusion here except for these linear foci here showing high signal on DWI and low signal on ADC images, but most of the tumor shows what we call T2 shine through, which is high signal on the ADC images. So again, mucinous rectal tumor, likely locally advanced with atypical features: low density or fluid attenuation on CT, high signal on T2 weighted images on the MRI, only peripheral contrast enhancement, and then very minimal restricted diffusion. Let's look at FDG PET CT in this patient. So we have the rotating image on the left. This was acquired to stage the tumor, and we see enlarged kidneys on both sides. We see the tumor, and so let's take a look at this CT image and the corresponding fused PET CT image. There is focal hypermetabolism seen in bilateral inguinal lymph nodes, and this is metastatic because the tumor is a low rectal tumor. We know low rectal tumors can drain through the lymphatic pathway of anal canal, and that is to the inguinal lymph nodes. So we see inguinal lymph node involvement showing hypermetabolism. The tumor itself is secreting mucin, so we don't see hypermetabolism inside, but only at the periphery. That's atypical compared to other conventional solid rectal tumors. And then we have this image at the level of the perineum showing again the tumor and the extension of this tumor into the right ischiorectal space, making it a locally advanced tumor, a sign that we see very clearly on this patient's fused PET CT image. Let's look at some more images on the same patient. Here on this rotating image, I want to show you this focus. This is a metastatic lymph node. Look at the degree of hypermetabolism there. It's not very hypermetabolic, and that's because if you look at the metastatic disease on the axial image and the fused axial image, we find that there is only peripheral hypermetabolism, and the central hypodensity is because there is mucin there. There are no cells there to show increased FDG uptake except in the periphery that we saw. The other interesting finding is, now let's go back to the kidneys. On the rotating image, we see that the right kidney is making some radioactive or excreting radioactivity into the collecting system in the ureter. And so the function of the right kidney is better and more preserved compared to a chronically obstructed left kidney. And we see the same finding here where there is cortical thinning worse on the left side compared to the right side. We see some cortex is still remaining, and based on what we see on the PET images, we can say the same thing, that there is more chronic hydronephrosis on the left side, which is hardly making any radioactive urine or excreting FDG into the urine compared to the right side where there is preserved cortical thickness and some excretion of FDG into the collecting system in the ureter. So remember, mucinous rectal cancers are not very common. They produce a lot of mucin, so there is no internal enhancement. There is only peripheral enhancement. Similarly, there is no internal FDG uptake. There is only peripheral FDG uptake. And metastatic disease will also secrete mucin, leading to only peripheral mild hypermetabolism rather than focal hypermetabolism that we see with conventional rectal cancers. This is a great review paper on this topic of mucinous rectal cancer and the atypical appearances on different imaging modalities. Let's look at our next patient. So this patient presented for restaging of prostate cancer, and we performed a PSMA PET CT. On the rotating image, we don't see any local recurrence or metastatic disease. We see this focus of faint uptake in the penile urethra. It corresponds to this focus on the fused PET CT image. And look at the coronal image. And so this is not tumor because it is where the urethra is supposed to be in the penis, where on both sides we have the corpus cavernosum, and in the midline we have corpus spongiosum where the urethra runs. So this is focal stasis in the penile urethra and not recurrent or metastatic PSMA avid prostate cancer. This is a good article on the topic, a practical guide to the pearls and pitfalls of PSMA PET imaging. Here's our last case. This patient presented with metastatic prostate cancer. We see increased uptake in the prostate. We see metastatic disease in the retroperitoneal lymph nodes. And after treatment, we find that the focus in the prostate has gotten smaller and the metastatic disease in the retroperitoneal lymph nodes showing PSMA uptake on the prior study have completely resolved. So PSMA is a great modality to follow up patients with prostate cancer to look for treatment response. These are more images from the same patient showing initially uptake in the prostate and retroperitoneal lymph nodes, and then the prostate becomes less active and smaller, and the retroperitoneal lymph nodes have responded as well. And this is a good paper on the role of PSMA PET CT in prostate cancer, current and emerging applications. Thank you for watching.